Hello, my name is Melanie, and I'm just one of the awesome nurses that you're going to encounter at Boulder Community Health in the Orthopedics unit. Thank you for taking the time to watch this online video of your preoperative joint replacement class journey. We will be discussing everything from pre-anesthesia testing to your discharge planning home. First, we will be discussing your care team. As the patient and family members, you are the most important part of the team. The care provided needs to meet your specific needs. Your surgeon not only performs the procedure, but is responsible for your overall care while you are here. Your RN, or registered nurse, coordinates with the team and provides assessment and monitoring of your overall care. Some main responsibilities include giving medicines, pain management, tracking vital signs, and your surgical incision. Please use your call light as we are here to help. Your PCA, or patient care associate, will help with personal care activities, meals, and take your vital signs like your blood pressure. If needed, your surgeon may ask other team members to work with you. These could include a PT, or physical therapist, OT, or occupational therapist, or case manager, discharge planner. Their roles will be discussed later in the presentation. After your surgery is scheduled, you will receive a call from pre-registration department asking for insurance information, emergency contact numbers, and a time to schedule a phone interview with a pre-anesthesia testing nurse. This phone interview generally takes 15 to 30 minutes and will be with a registered nurse who will determine if any pre-anesthesia testing is needed based on our guidelines. Examples of pre-anesthesia testing includes blood tests, an EKG, or other tests. The nurse will set up an appointment with you if testing is needed. You may also receive a phone call from our pharmacy department. They will ask you for a list of all the medications you take, including the dose, how often you take the medication, and the reason for the medication.
You may also call the pharmacy department if you have any concerns. Remove all nail polish from your fingers and toes and report any wounds, scratches, or abrasions to your surgeon prior to surgery to decrease your risk for post-surgical infection.
Now let's talk about what you're going to be bringing to the hospital with you. Please do not bring any medications unless specifically directed by your surgeon. We have free Wi-Fi, so you can bring a laptop or tablet, cell phone, and charger. Medication should be left at home unless you are told otherwise. Please don't bring any valuables such as jewelry or large amounts of money. If you use a continuous positive airway pressure or CPAP machine at home, please bring that for your use. Also, bring the joint replacement booklet with you to the hospital. The information in the book will be reviewed during your stay. There are several ways that you can help promote a healthy lifestyle and prevent surgical infections. If you have any existing health conditions, please discuss them with your surgeon. If you have health problems such as diabetes, please discuss this with your provider prior to your scheduled surgery. Quit smoking if you are a current smoker. Patients who smoke are 2 times more likely to have problems healing. Shower every day for 3 days leading up to surgery with plain or antimicrobial soap and the day of your surgery. Lather soap over your entire body, including your face, and then rinse. Be sure to wash your hair the day before your surgery. Always dry off with a clean towel. It is very important to avoid shaving near the area you will have surgery for 3 days before your surgery. Shaving with a razor can irritate your skin and make it easier to get an infection. And finally, be sure to brush your teeth twice every day. We are now going to discuss the day of surgery. The morning of your surgery, you should take your medication with a small sip of water if directed by your doctor. Your arrival time at the hospital will be discussed during your pre-anesthesia phone call. Check-in is at the central registration, which is on the first floor just inside the emergency department patient entrance. In preoperative holding, you'll be met by one of our nurses. You will receive an IV, anti-embolism stocking, or TED hose, and meet with the anesthesiologist. Iodine swabs will be applied twice to the inside of each of your nostrils. This is done to help prevent an infection. Please let your provider know ahead of time if you are allergic to iodine. The surgical site will be cleaned with special soap, and clippers may be used for hair removal. Please let the nurse know if you have any skin breakdown or skin issues. The anesthesiologist will discuss different types of anesthesia available to you for your procedure, and consent forms will be signed. There are 3 main types for anesthesia: nerve block, spinal, or general. A nerve block numbs a specific area, usually a limb. A spinal will make you numb from the waist down, and a general puts you to sleep. Your doctors will discuss the best type of anesthesia for your individual needs. A sacral dressing will be applied in the operating room. This is a foam dressing over your bottom area to prevent skin breakdown while you are in surgery. The dressing may be removed once you are able to get out of bed or prior to discharge. You will then be off to surgery. After surgery, you will be in the recovery room. Your nurse will work under the direction of your anesthesiologist to give you medications to manage your pain or anything else that is needed. You may start ice chips. When you're in the recovery room, your vital signs like heart rate and breathing rate, oxygen level, and temperature will be monitored.
When your vital signs are stable and your pain is controlled, you will be transferred out of the PACU unit to either 3 North or discharged to home.
There is equipment that will be attached to you after your surgery. You will be on oxygen after your surgery. Initially, you will have a mask on, but when you are awake enough, we will switch the mask to a nasal cannula that sits just inside your nose. On your finger, you will have an oxygen probe to monitor the amount of oxygen in your blood. This tells us if we need to give you more or less oxygen. You will have an IV in your arm so we can give you fluids and medications. Your incision will have a dressing on it. You will have TED hose and a sequential compression device, also called SCD or leg pumps, on your legs. This helps prevent you from developing blood clots. You will also have a cooling device of some sort, whether it is an ice pack or an ice machine. Lastly, if you had a posterior hip replacement, you will have an abductor, ABD, wedge pillow. Next, we will review what you can expect when you arrive to your hospital room from the recovery room. You will have frequent vital signs taken, which include heart rate, respiratory rate, blood pressure, and pulse oximetry. You will begin taking fluids and food, and you will start increasing your activity level. IV fluids will be given and antibiotics if ordered by your surgeon. You will get out of bed with the physical therapist or nursing staff. The goal is to walk within the first 8 hours after your arrival to the unit. We will be discussing a pain management plan, as well as how to use the pain scale. Pain is expected after surgery, but our goal is to have your pain level at or below your pain goal. Medication will be given to help with your pain, as well as ice, positioning, and relaxation techniques. Next, we will be discussing how to prevent complications. People can feel nauseous after surgery. We have medication that can help, so let your nurse know if you are feeling nauseated. Blood clots are a potential complication. There are things that you can do to prevent your risk of a blood clot. These include taking your medication as directed by your surgeon, doing active leg motions such as ankle pumps, which is moving your ankle back and forth. Do not sit longer than 30 minutes without changing your position. You will want to avoid long car rides. If they are necessary, be sure to get out and walk for a few minutes every 30 to 45 minutes. Wear your surgical stockings, called TED hose, and please notify your surgeon before surgery if you have a history of blood clots. To prevent falls, it is important that you use your call light when you want to get out of bed. Being attached to multiple tubes and lines and taking pain medication makes you at risk for falling. Unless your physical therapist has stated you are ready to walk on your own, call for assistance. You will have yellow socks with sticky grips on the bottom to prevent you from slipping. When you get out of bed, a staff member will be within your arm's reach to ensure you stay safe. This includes going to the bathroom with you. If you get out of bed without calling a staff member before being cleared by a therapist, we may use a bed or chair alarm as a reminder to call when you are getting out of bed. Pneumonia is another potential complication.
Nursing staff may instruct you on deep breathing and coughing techniques to keep your lungs healthy.
Constipation can be prevented by drinking a lot of fluid and eating a high-fiber diet. There are also medications listed in your joint replacement booklet that can be taken to prevent constipation.
Start your stool softener the night before your surgery.
Infection is the last complication we will discuss. Ways you can prevent infection include keeping your hands clean. You can wash your hands with soap and water or use hand sanitizer. This includes your family and friends once you are at home. This is one of the most important things you can do. Be sure to follow your surgeon's directions about caring for your incision and take your medications as prescribed. Getting out of bed and walking can help prevent several of the complications discussed, such as blood clots, pneumonia, and constipation. There are certain goals you will need to meet before you can go home. You will need to be able to tolerate foods and liquids. Your pain will need to be managed with oral pain medication. You will need to be able to urinate. You will no longer need oxygen, or we will help arrange for you to have oxygen at home. You will need to meet therapy goals. A case manager may be assigned to assist with your discharge needs. These include things like home care to ensure a safe discharge and a transition home.
Discharge home is usually from the same day of your surgery up to 2 days after your surgery, and you will usually be discharged by 11 a.m. on the day of your discharge. Please plan your ride home accordingly.
Meals on Wheels is also available to assist with meals. Resource information is available in your joint replacement booklet. Some patients may qualify for discharge on the same day as surgery. This will be discussed with your surgeon before you have surgery. You would be expected to meet the discharge goals we just discussed and would be required to have a dedicated caregiver for the first 48 hours after your surgery. You would also need to meet the therapy goals before your discharge. Some people do not qualify with certain medical problems. Here are a few links for medication disposal information. These include recommended pharmaceutical disposable practices and prescription drug drop-off information. This is for prescription medications that are not used.
Boulder Community Health Foothills Hospital is now a controlled substance public disposal location. The prescription drug drop-off box is located in the Foothills Emergency Department entrance. To find a location close to your home, visit bouldercounty.org or fda.gov through the links in the description of this video.
Hello, my name is Becky, and I'm a physical therapist here at Boulder Community Health. I will be discussing the role of physical therapy, also called PT. The role of the PT is to assist and educate in mobility issues and help you get back to the life you would like to live. These include things such as preparing for your discharge home by being independent, getting in and out of bed, walking in the hall with an assistive device, and safely managing stairs. The PT will also review the exercises that will help you regain function and range of motion in the affected joint, and educate you about any restrictions or precautions necessary for safe recovery.
My name is Kelly, and I'm an occupational therapist at Boulder Community Health, also called an OT. The role of the OT is to make sure that you have the equipment needs for home and that you know your precautions after your surgical procedure. We will also teach you safe techniques for getting into and out of your shower and on and off your toilet. We will make sure you know how to get dressed and bathed before you leave the hospital with the precautions that you have. The role of the patient is to want to get better to go back to your previous functional level or better. Please ask for pain medication if needed before therapy, and the therapists will check in with your nurse before getting you up and moving.
There are several therapy goals for you. The first is getting in and out of a flat bed on your own. The second goal is to walk on a flat surface using an assistive device, typically about 200 feet. The third goal is to go up and down the appropriate number of stairs. We will help you problem solve doing the stairs with or without handrails and how to do it for your own home situation. We will also make sure that you know how to get into and out of the shower and on and off the toilet safely. What can you expect from therapy? On the day of surgery, if you arrive to the unit before 4:30 p.m., you will have a visit from the physical therapist. We will check in with your nurse to be sure you are ready to meet with us. You will be getting up with the use of a walker. We will show you how to get up and stand with a walker. Some people will walk in the room, and some may be able to walk outside of the room. We will use a gait belt to help support you and make sure you are safe. If you are not able to see a PT on the day of your surgery, the nurse will help to get you out of bed later that day. You may be seen by PT in the PACU and discharged home from the PACU on the same day as your surgery. On post-op day 1, which is the first day after your surgery, you will receive a visit from physical therapy. We will go over how to get out of bed, how to stand, and how to walk with a walker. We will also practice going up and down stairs. Crutches may be used to assist you with the stairs. If you have not met your goals on post-op day 1, you may need to stay another day. In those circumstances, the PT will continue to work with you. Some of you may need home care PT. That need will be determined by your surgeon, therapist, and your individual needs. Occasionally, a rehab or skilled nursing facility stay is needed. This will also be determined by your surgeon, therapist, and your individual needs. Outpatient therapy typically takes place for total knee replacements 7 to 10 days after your surgery. You will want to schedule your outpatient therapy ahead of time since therapy sessions fill up quickly. For those of you having a hip replacement, outpatient therapy generally takes place 2 to 3 weeks after your surgery.
The occupational therapist will see you the day after surgery if ordered by your surgeon. The OT will work with you and assess your ability to get dressed, walk to the bathroom to complete standing bathroom tasks, and assess your ability to get into and out of a shower, as well as on and off a toilet. The OT will assist you in making decisions for bathroom equipment needed at home. Your disposition, such as home care, rehab, or skilled nursing facility stay, will be determined by your physician, therapist, or individual needs.
You may also be seen by the occupational therapist in the PACU if necessary.
We will assess your equipment needs. There is a website link to community loan closets in your Joint Clats booklet, where you may get walkers, crutches, commodes, clamp-on grab bars, and shower chairs. Friends, family, or churches may also have pieces of equipment you can borrow, or you can purchase new equipment from the list located on the back of the loan closet list. Small pieces of adaptive equipment such as reachers, sock aids, long-handled sponges, and shoe horns are available to purchase in the Boulder Community Health gift shop.
You may also purchase many items from Amazon.
If you have a shower tub combo with glass doors, we recommend that you remove the doors and use a shower curtain instead. If you go home with certain precautions, it can be unsafe for you to have to climb over a tub. You do not need to bring in your walker or crutches unless you need them adjusted to fit your height. We have walkers you can use while you are here in the hospital. We do not have walkers for you to take home. Home safety preparation. Pick up throw rugs, cords, or other fall hazards that may make it difficult for you to move about your house safely. Place items most frequently used on countertops versus having to reach high or bend low into cabinets to get them. Place items in refrigerator on a shelf that is easy to reach. Make meals in advance and freeze them, or buy pre-packaged salads or easy prep meals. Consider writing down the time you take your medications to keep track of when you've taken them. You may want to take your medications 30 to 45 minutes before activity or getting up first thing in the morning.
It is important that you have handrails for going up and down the stairs to keep you safe. You can have temporary grab bars installed if needed. If you do not have rails, you may use crutches, but they can be a fall risk for some people. You cannot drive while taking narcotics. Your ability to drive will depend on the leg you have surgery on. Your right leg will take longer to use when you start to drive. Your left leg will take longer to use if you drive a car with a clutch. Driving with your left leg in an automatic car will not take as long. You may take a mini driving evaluation at the outpatient clinic if you feel it is needed. Pre-op exercises. The straight leg raise is done while lying down by bending one leg and raising your extended leg. Do not do this if it is overly painful. This exercise is only done before your surgery to strengthen both legs. We encourage chair push-ups. These are done by placing your hands on the armrests of a chair and pushing down and lifting your bottom off the chair. Do this several days before your surgery to strengthen your triceps. You will be using these muscles when you walk with a walker or crutches. Total knee replacement goals. We will measure the bend in your knee with a device called a goniometer. The measurement will be recorded on the whiteboard in your room. We encourage active range of motion in your knee. It is your responsibility to continue to do the exercises once you go home.
After an anterior hip surgery, you may not extend your surgical leg behind your hip or turn your leg outward, called rotation, like you would if you were kicking a soccer ball. For the Birmingham hip resurfacing, you may not cross your surgical leg over the non-surgical leg. You may cross your ankles when sitting. Do not roll your surgical leg inward, and you may bend your surgical leg past 90 degrees, but do not point your knee inward at the same time. You may have posterior hip precautions after your surgery. With a posterior hip surgery, you may not bend at your hip beyond 90 degrees, turn your surgical leg inward, or cross your legs while sitting. You are at risk to dislocate your hip if you do a combination of these motions.
Thank you for taking the time to prepare for your surgery by watching this video. If you have any further questions, please feel free to contact us. We look forward to caring for you during your joint replacement journey.